It is Occupational Therapy Month. Joining us live to talk more about the profession and its benefits is Danielle Jobin, Supervisor of Occupational Therapy at St. Peter's Hospital. Good afternoon.
Hi, good afternoon. Thank you. I'm really excited to be here today to talk a little bit about occupational therapy. Occupational therapy is an evidence-based practice that is very deep-rooted in science and history. We can find evidence of using occupation as a method of treatment dating back to 100 years before Christ, BC. Greek philosophers, Greek physicians found that if they would use therapeutic touch, massage, music, it would help to heal their patients. Fast forwarding to the 18th century, kind of during the Age of Enlightenment, the European physicians were founding that if they provided engaging activities and work and distraction to patients with mental illness, they tended to find that those patients didn't need the restraints and their behaviors were much more easily managed. So really engaging a person into the things that they need to do every day. Fast forward to 1917, Eleanor Clark Slagle, who is considered the founding mother of occupational therapy, proposed the idea that activities to work with patients who have, engaging mentally ill patients, engagements in meaningful routines, I'm getting my words mixed up, shaped a person's well-being. She promoted the idea of habit training, which focused on creating balance between work, rest, and play, and leisure. And then we can kind of fast forward as well into World War I, where the profession itself really changed dramatically in that we went from being a therapeutic activity based on crafts and leisure into focusing more on activities of daily living. This is really where we started the rehab phase of working with people on the activities that they need to do every day.
And how does occupational therapy, or OT, really help people across their entire lifespan?
So we really help patients do the things that they need to do through the use of activities or occupations. OT practitioners have a holistic perspective in which they focus on adapting the environment and or the task to meet the needs of the patient and to fit the person.
And what are some of the typical services that OT provides?
So an OT will go in, it is a consulted service, so we are based on a physician request. We provide an individual evaluation, which really encompasses what the patient's goals and what the family's goals are. Through the objective measures that we get from that assessment, we develop a plan of care. Our objectives are measurable, achievable, realistic, based on the current needs of the patient. And then this plan of care is continually reviewed and upgraded, downgraded as needed.
And what are the educational requirements for anyone who might be interested in going into occupational therapy?
At this time, to become a registered occupational therapist, it is a master's level for entry into the program. For a certified occupational therapy assistant, it is an associate's level. Both roles are equally as important in the rehab of a patient. The difference being the registered occupational therapist completes the assessment, and then the following up with the plan of care and the treatment can be handled by either the registered occupational therapist or the certified occupational therapist.
Wonderful. Well, thank you. We really appreciate you taking the time to talk about your profession today, and we hope to hear from you again soon.